Good evening to everyone and very warm welcome to today's webinar. I am Suman and I am delighted to welcome you all to Nursing Next Life flagship series UDAAN by the student and for the student. Today's session is based on extremely high yielding topic, that is no more thought block with hard block and types of hard block, a must known topic for exams as well as for clinical practice. So let's start today's session by discussing. So let's start with the discussion of itineraries. Today, what we are going to do. So first, we are going to discuss all about the NNL and the special rewards. And after that, we are going to introduce our speakers. And now we are going to discuss our types of hard blocks, the topic of the today. And here from the NORCET topper as well as the university topper who has from our plan. Along with that, we are going to see a plan video and Q&A round with the closing remark with the special rewards. So before starting anything, let me introduce about Nursing Next Life. Before beginning with, here is a quick introduction of NNL1. So NNL1, formerly Nursing Next Life, which is most trusted digital learning platform for nursing aspirants, because NNL, formerly the Nursing Next Life, is an innovative for nursing edtech as well as CBS Public Distribution and Private Limited, because it aims to provide a high quality and accessible nursing education to the students across India, which is launched in August 2020. The NNL1 bridged the learning gap between medical and nursing domain and now offers a complete learning ecosystem for UG and MSc nursing, all as well as for the competitive exams also, like NORCET, like NCLEX, and INC based assessment test and many test series. All content is aligned with the latest INC syllabus and created by leading medical nursing experts. So NNL has expanded from online to offline education with NNL Academy, as well as which is situated in Noida, Uttar Pradesh, featuring CBT lab, simulator-based training, and in-person doubt clearing sessions with certificate programs and personality development modules. In 2025, NNL1 has launched its second center, the NNL EduHub in Jaipur, Rajasthan. So throughout this journey, we have UG-centric programs also integrating MSc, structured test series, and specialized modules for higher studies as well as international opportunities for nurses. NNL1 empowers nursing aspirants with a strong academic foundation and practical skills and exam-ready confidence. So as you can see, why NNL1 is the first choice of nursing students, because we have 7,500 plus selections across NORCET and major nursing exams, because it is a top-notch institute which provide a structured plan as well as strong student support ecosystem to the nursing students. Now, we are going to discuss the special reward which you are going to get after this session and after filling all the questions which has been asked throughout the session. Now, I'm going to introduce the speaker who are going to be in this session. So first of all, I wanted to introduce our mastermind faculty academic head, Ms. Priyadharsgini, a highly experienced educator known for conceptual clarity, clinical depth, and engaging teaching approach. She has guided thousands of students with her expertise in cardiac concept as well as for exam-related oriented teaching. Ms. Priyadharsgini Balan has begun her career as a lecturer at Sri Ramchandra Institute, a patent holder and recipient of All India Outstanding Nursing Research Award, as well as the SBV Indoor Gold Medal. She is well organized and recognized for her innovative teaching and research. With numerous publications in estimated nursing journals, she now brings her passion and expertise to NNL1, empower nurses as well as future nurses with advanced knowledge and skills. Ma'am, we welcome you in this webinar.
Thank you so much for your heartfelt welcome.
Now we move to our next speaker, Mr. Shurhabeel Chouhan. who is currently serving as a nursing officer in Pulmonary Critical Care Unit at AIIMS Rishikesh. He is dedicated clinical with strong academic and competitive exam achievements. He completed his BSc from Mike Hilja Institute of Nursing Science, Jodhpur, graduated in 2023, and was the third year college topper. During his fourth year, he has secured first prize in pediatric hemato-oncology quiz competition conducted by AIIMS Jodhpur. Shurhabeel has impressive track record in national level as well as in nursing examinations, securing rank 4 AIR 982 while still he is in fourth year. And NORCET 5, he secured rank AIR 277, along with that MSc entrance AIR 302 and CRE 2024 AIR triple 113, that is 113. Along with GMCH Air 299 rank, he has been working beside RN for 2 years in pulmonary CCU and also lifelong member of Hospice and Palliative Nursing Association and a member of Students Nursing Association. So, Mr. Shurhabeel Chouhan, we welcome for this session.
Thank you, ma'am. Thank you so much.
Now, let's move to our third speaker, Miss Priyanka M. She is dedicated nursing professional who secured an impressive rank AIR 571 in NORCET 9, and she has completed her nursing education from prestigious College of Nursing, JIPMER, graduated in 2022, and she is currently working in general surgery ward at AIIMS Mangalgiri with 2 years experience of clinical as well as a standout academic performer. She has earned distinction in 11 subjects, reflecting her strong commitment to the excellence and deep subject mastery. She brings her clinical expertise, discipline, preparation strategies, and academic brilliance to inspire fellow NORCET aspirants. So, Ms. Priyanka, we welcome you in this webinar.
Thank you, ma'am.
So now we are going to discuss the webinar guideline. So before moving ahead, let's have a quick discussion. One by one, you may have a questions related to the topic in the end in the Q&A box, and each speaker will answer the question. Selected question will be addressed during the Q&A round, and please stay till end because we have a special reward for you in the end of the session. So stay tuned. And now we are going to discuss our today's topic. So now let's move to our mastermind faculty, Ms. Priyadharsgini ma'am. She will be discussing the types of hard block in crisp, concise, and full exam-oriented manner, along with that correct exam approach for better understanding. Over to you, Ms. Priyadharsgini ma'am.
Yes, dear. Yes. So, a pleasant good evening, everyone. This is Priyadharsgini, your Mastermind Faculty of Adult Health Nursing. I welcome you all to the UDAAN webinar. And today we're going to discuss about one of the most important topic. And it was asked in your previous NORCET 9.0 examination also, right? So let's get into the topic. And you had a lot of introduction about the topic. Today's topic is about the types of hard block, as you all know. So what is heart block? Whenever you see a term heart block, you should not confuse yourself. It is because of any form of atherosclerotic plague or any thrombi or any emboli. No. Heart block is typically a problem in the electrical conduction system of the heart, which means we have an electrical pathway which is making the heart to contract and relax. When there is any interruption, we are terming the condition as heart block, right? So here, before going into the types of heart block, it is very, very important to learn about the basic anatomy and physiology of your cardiac conduction system. I hope the screen is clearly visible for you. The conduction pathway screen is visible, right?
Yes, ma'am.
Yes. Okay. So first, let us start with the SA node. As you all know, SA node is termed as your sinoatrial node, which is the primary pacemaker of your heart. Right? So this is a dominant pacemaker which actually generates the electrical impulses. So SA node is the primary and dominant pacemaker of the heart. It generates the impulses to do a heart rate of 60 to 100 beats per minute. It is situated in your right atrium, as you can see here. And next important part and the most important bifurcation part, or which means this AV node, the structure of AV node is allowing the impulses, is catching the impulses from SA node and allowing it to the ventricles. So it acts as a pathway where the impulses are catched from, or there is a delay or there is an interruption in this transmission of the impulses from SA node via the AV node, this condition heart block is classically diagnosed, right? And AV node is also a specialized structure. As you all know, it do important work, that is delaying. We know that AV node delay. What does AV node delay? This AV nodal delay, which means AV node will delay for few seconds to allow the ventricle to properly fill, right? So that the ejection will be properly maintained, right? So what is the normal purging capacity of electricity by your AV node? The normal purging capacity of your AV node is 40 to 60 beats per minute. Whenever the SA node is failing, at that time, AV node will take up an action and it will start to generate certain impulses. That is at the rate of 40 to 60. Next, we have an important structure, that is your bundle of His, right? So then you can understand from the atrium, the impulses are reaching the ventricles via the AV node, then the bundle of His. Right? This bundle of His is also having a capacity to generate the impulses. When SA node is also failing, when AV node is also failing, at that time, bundle of His will take up the role and it can generate the impulses of 20 to 40 beats per minute. Right? So next we have the bundle of His. Right, post bundle of His, we have the Purkinje fibers. This is your right bundle branch and this is your left bundle branch. Then again, this bundle branch will be innervated deep inside the ventricles as the Purkinje fibers. As Purkinje fibers. So this is the basic electrophysiology of the heart. How this impulses are generated and how the contraction and relaxation process is happening synchronously is seen in this particular image. The most important thing you people have to remember: nobody is making the heart to generate its nobody is compressing it manually or nothing like that. It is completely because of the specialized pacemaker cells which is present inside the heart, which is helping it to synchronously contract and relax based upon the following events. The most important thing you have to remember for NORCET point of view is the dominant pacemaker is your SA node, right? And the most important point I would like to add again, this is for the audience. Can you tell me which of the following part in the conduction pathway has the slowest conduction velocity? Which have the, so where we stopped, like I was asking you a question, which of the following part of the conduction system, which of the following SA node or AV node or bundle of His or Purkinje fiber, which is having a slow conduction velocity? Any answers in the chat box? Whenever there is an MCQ which is stating which of the following pacemaker cell is having a slow conduction velocity, obviously you people will be thinking like SA node is the primary generator of the impulses, then followed by AV node is catching it and AV node is distributing it to the ventricles. So AV node will not be the answer, but the actual answer is AV node. AV node has the slowest conduction velocity. Because of its physiological process of conduction delay and everything, AV node is having the very slow conduction velocity. Now you have to ask me an answer vice versa. Then who is the fast conduction velocity person, right? So which of the following pacemaker cell is having the fastest conduction velocity? The fast conduction velocity is by your Purkinje fibers. This is an important question which can be asked in future for all the NORCET aspirants. So please keep this in mind. Slow conduction velocity is by your AV node, whereas fast conduction velocity is by your Purkinje fibers. This you have to remember, right? So let's see the basic overview of the normal ECG before going into the actual condition. So here you know that P wave and the QRS complex and the T wave will be present in a normal ECG. right? What does P wave is indicating? P wave is indicating atrial depolarization. As you all know, P wave is indicating atrial depolarization, the point where SCA nodes starts its generation of impulses, right? Then you have the QRS complex, which is an important part. This is your ventricular depolarization. Your QRS complex is called as your ventricular depolarization. Now you can ask me the question, what does mean by depolarization? Depolarization means it is a contraction. Depolarization means it is a contraction, right? At last, we have the T wave. What T wave is indicating? T wave is indicating your ventricular repolarization, which means your ventricular relaxation. Remember R, relaxation, and ventricular repolarization. You have to remember in that way, right? So we have various durations in the ECG, right? The most important duration you people have to remember while studying about heart block is the first and foremost, you have to remember about the PR interval. So what is a normal PR interval? The normal PR interval is 0.12 to 0.20 seconds. So this is a very important concept which you have to by heart while studying about the condition heart block, right? The normal PR interval is 0.12 to 0.20 seconds. So what does this PR interval is indicating? This PR interval, which is starting from the beginning of the P wave to the beginning of the QRS complex, right? This is the PR interval. So what this PR interval is indicating? This PR interval is indicating the AV conduction timing. AV conduction timing. AV conduction timing. This PR interval is indicating the AV conduction time. So to be very classical, I have said you PR interval is very important in heart block, and heart block is the condition which is primarily arising because of any problem in the transmission of impulses from the AV node, right? So here we are coming to the conclusion, whenever there is a block, whenever there is an heart block, irrespective to its type, there will be an alteration in the PR interval duration. There will be the alteration in the PR interval duration. And the second most important duration which you have to remember is the QRS duration. The normal QRS duration is always 0.8 to 0.10 seconds, right? And the most important thing, again, you have to remember about this QRS is, you are telling it is a narrow QRS when it is coming within this particular ratio. And if you're telling it is a broad QRS, which means the QRS complex is so much broadened, when it is going greater than 0.12 seconds, when it is going greater than 1 to 2 seconds, then we are terming it as a broad complex QRS, right? It is a broad complex QRS, right? Coming back to the definition of heart block. Heart block is generally the problem in the electrical conduction of this electrical conduction system, right? It refers to the delay in the normal flow of electrical impulses that causes heart to beat, right? It is further classified as first degree, second degree. In second degree, further we have two types, that is type 1 and type 2. Type 1 and type 2. And we have the third degree heart block. So we have three types of heart blocks, and you're going to see in detail about what is the feature of that heart block and how to differentiate between first degree, second degree, third degree, and everything. And what will be the management and how you are going to diagnose the heart block with the help of ECG, which we are going to see now. That is a very important part of this lecture, right? So first, we are going to see about the first degree heart block. So what is first degree heart block? As I said you, when there is a primary problem, there is just a delay. SA node is sending the impulses to the AV node, but there is a delay in the transmission of that impulses. There is a slight delay in the transmission of impulses. And the most important point you people have to remember, in most of the cases, first degree AV block is always asymptomatic. Asymptomatic. And primarily, what are the feature you can see? There will be prolongation of the PR interval, which is given here so clearly. First degree AV block involves the consistent prolongation of the PR interval. Why we have mentioned the consistent word, that I'll be telling you clearly while talking about the second degree heart block. Remember, there will be the prolongation of the PR interval. So as we said, the normal PR interval is 0.12 to 0.20 seconds. Here, what will happen? It will be going greater than 0.20 seconds because there is a small delay in the conduction of the impulses, right? So it is due to the delay in conduction via the atrioventricular node, right? So, and the most important thing you have to remember again is every P wave will have its QRS complex, which means the conduction is delayed, but all the impulses which is generated by the SCA node is actually reaching the ventricles, and the ventricular contraction is also happening. QRS complex is the output of ventricular repolarization, as you all know, right? So every P wave is conducting to form a QRS complex, which means the impulses which is generated from the atria is reaching the ventricles, and ventricular contraction is also happening, but there is a delay, but there is a slowness in the conduction of the impulses, right? And there is no dropped QRS complexes, unlike some other AV blocks. Here you will not be seeing any form of drops. Each and every P wave will be having its respective QRS complex. And first degree AV block is common and often be incidental finding, right? So here you can classically see the ECG of the first degree heart block. As I said there is a prolongation of the PR interval of greater than 0.20 seconds. Other than that, you will not be seeing any form of classical features. So whenever we talk about heart block, just remember it is a bradyarrhythmia. It is a bradyarrhythmia where your heart rate is going to be reduced less than 60 beats per minute, right? So here, what about the rhythm? Every P wave is going to have its respective QRS complex, so the rhythm will be regular, right? See, you can see the P wave, you can see the QRS, you can see the QRS, you can see the P wave, you can see the QRS again. So every P wave is following its QRS complex, which means the rhythm is regular, but there is a prolongation of the PR interval. There is a prolongation of the PR interval, you can see. So normally if I'm telling you it is like 0.12 to 0.20 seconds, please remember one thing, which means it will be covering this PR interval duration, which means the beginning of the P wave to the beginning of the QRS complex, which means it will be coming around 5 small squares, right? So in this case, what will happen? It will be going more than 5 small squares. To be very easily, you have to remember, or while seeing the ECG, if you want to correlate, you have to remember in this way, right? But you have to be very clear about the duration only. The duration of the PR interval is going to get prolonged of greater than 0.20 seconds. That is the most important thing you have to remember. And what about the QRS complex? The QRS complex will be having normal morphology. The ventricular contraction is happening, but there is a delay in the AV nodal sending the impulses to the ventricles, right? So next we have the second degree heart block. The second degree heart block is otherwise known as second degree type 1 or the first type. We are talking about the second degree type 1, which means we are talking about the type 1, the first type of the second degree heart block. This is otherwise known as Mobitz type 1 or the Wenckebach phenomena, which is named after the scientists who have discovered this particular rhythm, right? So what is the classical feature of second degree heart block? That too specifically type 1. In second degree type 1, right, you'll be having progressive prolongation of the PR interval, which means sequential prolongation of the PR interval will be there. In the first cycle, the PR interval will be 0.22. In the second cardiac cycle, the PR interval will be 0.30. In the third cycle, the cardiac cycle will be greater than 0.40. So like that, there will be a progressive prolongation of the PR interval, right? So that is your second degree type 1, which is otherwise known as Mobitz type 1 or your Wenckebach phenomena, right? The PR interval until eventually the atrial impulses is not conducted and the QRS complex is dropped. So what is happening when we are not treating this particular condition? It will lead to Mobitz type 2. That is your second degree type 2 heart block. But you people have to remember this very clearly. Most of all, in most of the cases, you will not be seeing any drop in the QRS complex in second degree heart block, second degree type 1. Okay, you'll be seeing a progressive prolongation of the PR interval. So it will be very clear for you if you are going to see this ECG. So first, if you see the PR interval in this ECG, you can see the first PR interval, the second PR interval, and the third PR interval. See, there is a progressive lengthening of the PR interval, right? Which means what is actually happening? First, I'm generating the impulses, I'm sending, it is a slight delay. Then the second impulses which I'm generating, it is even more delayed. The third impulses which is generated by the SA node and which is reaching the AV node, it is even more delayed. Like this, sequentially, there is an increase in the PR interval duration that is termed as your second degree type 1 heart block. Obviously, here the rhythm may be irregular because in rare cases, you can see the drop in the QRS complex. But to diagnose the patient as a case of second degree heart block, at least you need a 2 sequence. For example, this is first sequence and this is the second sequence, and you can see the variation in the PR interval. But in first degree, what we have seen, there will be no variations in the PR interval, but the PR interval will be prolonged. Fixed duration will be there, but there will be prolongation of the PR interval. But here, what is happening? First, I'm sending it more strengthened. Next, it is even more delayed. Next, it is even more delayed. Like that, it is a progressive prolongation of the PR interval. So every P wave is present, but not all followed by the QRS complex. This is in case of like when the condition is very worsened. Delay and delay and delayed, at last, no ventricles. Ventricle is not at all contracting because I can't able to send proper impulses to the ventricles. So that's where there will be a drop in QRS complex. But you have to diagnose it in 2 consecutive rhythms, in 2 consecutive cardiac cycles. If the PR interval is progressively prolongating, then you are concluding it is a second degree type 1 heart block, right? So the classical feature which we have already highlighted, that is a progressive lengthening of the PR interval before the drop in the QRS complex. Even more weakened and weakened, at last it is dropped. For example, if you're not seeing a sequence in progression of the PR interval, then you have to think about second degree type 2. Second degree type 2 is otherwise known as your Mobitz type 2 AV block. So what is the classical feature of Mobitz type 2 AV block? Right. So in first degree, we have studied it as prolongation of the PR interval. In second degree, it is a progressive prolongation of the PR interval. In second degree type 2, what is the case here? Remember, there will be consistent PR interval, highlighting this point. There will be a consistent PR interval, and intermittently there will be a drop in QRS complex, right? I have a very regular PR interval, but I have a drop in QRS complex. Certain impulses are not at all contacted.
Sorry to interrupt, ma'am. Sorry to interrupt you, but we have a time crunch. We have to finish it thoda early. So
Okay. I
please try
understand.
to understand, ma'am.
Yes. So listen, in second degree type 2, what is happening? There will be consistent PR interval. Right, the PR interval duration will be very consistent, but you will be having a drop in QRS complex, which means I have a regular PR interval, but certain impulses which is generated from the SA node is not at all reaching the ventricles, and the ventricles are not contracting. Whenever there is no QRS complex, it is specifically understood there is no ventricular contraction. So that is the case in second degree type 2. And second degree type 2 is considered to be the most dangerous rhythm. Most dangerous rhythm. If there is an NORCET MCQ which is stating which of the following heart block is considered to be most dangerous or most dreadful or most life-threatening, it is your second degree type 2. If you are taking second degree type 2 patients so carelessly, it will lead to third degree heart block, right? So again, in second degree only, you can see this component of repeating cycle, like 3:1 block and 4:1 block. This 3 is indicating the P wave and 1 is indicating the QRS, right? For every 3 P wave which is with its respective QRS complex, there will be a drop. The third wave, you will be seeing a drop in the QRS. Like this synchronized pattern you can see in your second degree type 2. Again, coming back to the rhythm of your second degree type 2, it is going to be irregular. Or sometimes it can be regularly irregular in case of 3:1 block and 4:1 block, which means the same pattern will be followed. So here it is a 2:1 block. Here you can see it is a 2:1 block. So here I'm highlighting, see, the PR interval is consistent, but you can see here there is no QRS. Again, you can see the PR interval is consistent, but again, here there is no QRS complex. This is the 2:1 block, right? The same pattern is followed. But the most important thing you have to remember is it will be having a consistent PR interval, but a drop in QRS complex, right? So next, the QRS complex, it will be normal, the normal duration of the QRS complex will be maintained, okay, which is less than 0.12 seconds. Or in some cases, in severe cases, which is leading to third degree heart block, at that case, it is going to be greater than 0.12 seconds, which we are terming it as a broad complex QRS, right? So here it is a short glimpse about the first degree and the second degree alone. First degree, prolongation of the PR interval, right? Greater than 0.20 second. Second degree, type 1, Mobitz type 1, there will be progressive lengthening of the PR interval. In second degree, type 2, there will be a consistent PR interval, but there will be the drop in QRS complexes, right? The last degree which we are going to see is the third degree heart block, right? The third degree heart block is a very, very serious form of heart block. And in second degree and third degree, you'll be seeing the patient with various symptoms because of insufficient cardiac output and bradycardia, right? What is the classical feature of third degree heart block? The third degree heart block, the classical feature is there will be no association between the P wave and QRS complex. In a normal ECG, you all know every P wave should be with its respective QRS complex. But in this case of third degree heart block, P wave will be generating one impulses, QRS complex will be generated at one time. So like that, there will be no association. What actually it means? Which means atria is generating impulses. That impulses are not at all utilized by the AV node and carried to the ventricles. And so what ventricles is doing? Ventricles is auto-generating its own impulses to maintain the cardiac output. So that's where this AV dissociation happens, the atrioventricular dissociation. P wave is purging its own impulses and atria is contracting in its own way. Ventricles are started to develop its own impulses and ventricles are contracting in its own way. So every P wave will not be associated with the QRS complex. So that is termed as your third degree heart block, right? So here the rhythm will be completely variable. Either it can follow a regular pattern or it can follow an irregular pattern. In most of the cases, it will be irregular. So here you can see the QRS complex is there. Your QRS is there. And again, you have a P wave. The P wave is not having its QRS. Again, you have a P wave, QRS, P wave, no QRS. And like that, there will be no association with the P wave and the QRS complex will be seen in this condition, right? To conclude, I'm telling you, if at all the patient is a case of symptomatic bradycardia, right? In case of Mobitz type 1, second degree Mobitz type 1, the drug of choice in the primary management so the drug of choice is atropine in order to maintain the cardiac output, right? So atropine, we will be starting from 0.5 mg. For every 3 to 5 minutes, we will be repeating its dose. And this is a very, very important NORCET question. Maximum, how much amount of atropine we can give? That is 3 mg, not more than that, right? So here I have given you a short poem where you can easily remember about the types of heart block. I hope the session was really helpful for you. We'll meet you all in the question and answer series where you want to ask whatever doubts regarding this particular topic. I'll be answering it for you. I hope it was really helpful for you people. Thank you so much for this wonderful opportunity. Yes, Suman, you can take over.
Thank you so much, ma'am, for giving such informative and important insight related to the NORCET in this topic. So now we are going to move to our next speaker. So our next Margdarshak, Mr. Shurhabeel Chouhan, will provide deeper insight into this topic from the exam point of view. And he will also explain why this topic is so crucial for NORCET aspirant and guide you the correct way to approach and attempt such questions in this exam. So Mr. Shurhabeel, it's over to you.
This beautiful highlight on this topic. So basically, it is important because it is important for the ECG part. Na? They will give you some strips. They will give you some strip and they will tell you to find the pattern rhythm, and they will give you multiple options. And people being in a setting key is there will be a question on ECG mainly from ventricular tachycardia and fibrillation. So they might tend to tick without reading the rhythm and all. But now, as ma'am has beautifully explained, so you first have to calculate na सबसे पहले if you see a ECG, the first thing is to calculate the rate. What is the rate? The patient is in bradyarrhythmia or tachyarrhythmia. So first of all, उससे आपके it will help you eliminate almost one or two options. If you find the case of bradycardia, then you can think of any heart block or myocardial infarction. Before and after it, after the misbeat. If the PR interval before and after the misbeat is same, then you can term it as a Mobitz type second. If it is different, then you can term it as a type first, because you ma'am has explained that there is a progressive prolongation followed by a drop beat. So if there is drop beat, just see the PR before and after the drop beat. If they are both same, mark is type 2. If not same, mark as type 1. Simple. You don't have to remember key if there is progress. So these are the short tips which will help you at that time. Important for a third degree heart block and second degree type 2 and heart third degree is important because of the management. If the drugs are not working, the first line is obviously atropine. We used ADR and dopamine simultaneously. If all these drugs fail, we don't wait for कि हम और drugs देंगे. We just switch to transcutaneous pacemaker or transvenous pacemaking. So it is important कि if the main treatment of choice he will ask, then you should give कि it is transcutaneous pacing. And the important part in that कि what is the pedal placement, right and left. What is the pedal placement? That is important. So second ICS right pedal, right side में second ICS, and sixth ICS lateral to the nipples. That will be your left side. So pedal placement is important from the from the transcutaneous management. So this is from my side, and sometimes the third degree heart block is also known as Stokes-Adams syndrome. So you can also write. He might give you sometimes कि what is option में third degree ना देके he gives you Stokes-Adams, because day by day the level is advancing, so we don't know, we must be knowing. So just add कि it is known as Stokes-Adams syndrome. Okay, and the first important and the last point from my side कि जैसे 100 to 200 is your tachycardia, 200 to 350 is your flutter, and more than 350 is your fibrillation. This range is also important because people usually tend to forget ki what is flutter and fibrillation. So this is also important to know the what is the exact range. So आपको ये नहीं रहेगा कि 250 में मुझे क्या करना है, 300 में मुझे क्या करना है. Just remember the range and mark the options. And important nursing management is always ABC, because if the patient is having a missed beat, means his heart is not contracting, means there is no perfusion to the brain, so that he or she might land up into dizziness or hypotension. So there is a chance of aspiration or fall. So the first important is protection of airway, fall management. If you want, you can just intubate the patient to protect the airway, and you can just keep the patient under watch, under cardiac monitoring, and you can find the pattern and treat accordingly.
Thank you so much, Mr. Shurhabeel, to making us understand this crucial part in very easy manner. So now I'm going to invite our third speaker, Ms. Priyanka. So moving ahead, our speaker, Ms. Priyanka, will guide us how important this topic is related to our exam point of view. Along with that, she will share our experience with the NNL1, how the NNL1 help her to prepare this topic with the right approach to attempt these questions effectively in the exam. So it's over to you, Ms.
Thank you,
Priyanka.
ma'am. I'm happy to share. Sir have clearly explained about heart block and its types. Today, after this on this session, first thing is to build a strong foundation. Priyadharsgini ma'am have clearly explained the pathway So you make your own pathway, flow chart, mind map for the conduction. Then mostly questions will come like ECG interpretation, its management and symptoms. For ECG interpretation, there is a poem ma'am has also showed in her slide. Read that slide 2 times, you will understand. Most important is the PR interval and the QRS. If you understand both these things, you will be able to find out its ECG interpretation. Then if you read well and teach others, you will remember it for a long time. Then make a table for its symptoms and management. Highlight the important topics. Ma'am has already told in second degree, third degree, progressive, constant, PR interval, like that. Revise these highlighted topics before exam, so it will be easy for you to answer in exam, because in exam they will give options that will be difficult to take the correct answer. Then solve more questions. If you are reading about any topic, after watching any video, you solve more questions, so you will be able to understand the examiner's point of view, how they are framing questions. Then you discuss with your friends. Then correlating clinical areas, patients ECG findings. Then NNL, I have watched only fast track classes, cardiovascular system. In that, Priyadharsgini ma'am have given detail which is important for a exam point of view, what and all the important things. Then for NORCET 10 exam, you have only 126 days left. So this is the right time to start your preparation. Then solve more MCQs. So MCQ solving ability will decide your rank. Then need to revise frequently the volatile topics, discuss with your friends, so it will help in memory retention. Studying every day is the key to success, so start preparing from today. Thank you ma'am for this opportunity. All the best students. Thank you.
Thank you so much, Ms. Priyanka, for excellent explanation you had made to clear this concept and the strategy regarding the exam. So now we are moving to watch a very informative video which is related to our plan. So I'm sharing the video.
C+ Platinum Prime Edition, your all-in-one solution for NORCET prep in English and Hinglish, trusted by toppers. This plan is here to make your success certain. We understand the challenge of studying complex topics in unfamiliar languages. That's why we created a clear, simple, and student-friendly learning experience, 100% student and language barrier-friendly. New features and new approach, designed for complete NORCET preparation. Learn from the masterminds behind 6,500 plus NORCET selections. Our expert faculty will guide you every step of the way. With experience, expertise, and excellence, they've got your back. 600 plus masterminds led hours of conceptual classes and concept-based video assessments to strengthen your foundation. This plan delivers content in both Hinglish and English. Switch anytime. Practice with over 20,000 topic-wise questions, previous year recalls, and a structured Masterstroke learning path. Revise faster with 600 plus high-yield topics, available in Hinglish and English. Study as per your language preference and avoid language barriers. Test yourself with our strike and prediction test series with real-time national rankings. Get one-on-one mentorship, doubt-clearing sessions, and monthly progress reviews to stay on track. What's new in the plan? Strike prediction test series for NORCET 10.0 and 11.0. For all queries, contact Customer Care Desk, Central Test Follow-Up Department. For more effective learning, for important tests, and get monthly progress report. Meet your Margdarshaks, the experts who will guide you throughout your preparation. Personalized prep strategy.
कल के दिन जब आप पढ़ने के लिए बैठोगे, सबसे पहले अपने पुराने कंटेंट को आपको रिवाइज करना है.
Concept clarity sessions.
सबसे पहले हमें क्या फोकस रखना है कि हमारे जो मेजर सब्जेक्ट हैं, जो मेन 6 सब्जेक्ट हैं, वो कंप्लीट होने चाहिए. ठीक है.
Performance tracking.
तो सबसे पहला है अब क्या करना है, अब हमें और पढ़ाई करनी है।
Direct mentor interaction.
उसके बाद मारवा सर के लेक्चर में जाओ और फिर मिलने से, तो आपको टाइम कम लगेगा।
Plus, enjoy free access to one-time revision by Miss Sabina worth 2500 and Plan Aptitude and Reasoning worth 1850. Enroll in Plan C Plus Platinum Prime Edition today and make NORCET 10.0 and 11.0 your success story.
So now let's just move ahead with the another slide, which we are going to see our Margdarshaks.
Welcome. Welcome. This is the plan.
Now we have already seen our Margdarshak MBM session, in which we provide guidance and mentor to all students by which they can clear their doubts and any problem they are facing during their exam preparation, and any strategy related problem. They can directly one-to-one interact with them and book their session with the Margdarshak to get a proper strategy and plan with them. These are our rank holders and toppers who have achieved a good rank in AIMS NORCET 9.0 2025. And these are our 7,500 plus selections for 5 consecutive years, which we have already owned. Now moving to our next round, that is Q&A round, question and answer round. Now all of you can ask any question regarding this topic which we have discussed during the session. So start writing your question in the chat box, by which we can start discussing one by one. So here we have a question. Please repeat the range which sir has told about the flutter and all. Priyadharsgini ma'am, I want to request you that to answer this question and clear the doubt of the student.
See, for atrial flutter, the range of the heart rate will be going more than 200 to 350. That is the rate. So one more important point I would like to suggest for you people is, as the second speaker has said it so importantly, I have said you about the drug of choice of your heart block, right? It is atropine. That works only when the patient is symptomatically, he is having a bradyarrhythmia, right? When the patient is going for second degree type 2, okay, Mobitz type 2 or complete heart block, in that case, atropine is not going to work efficiently. The only management which you have to target or click is your transcutaneous pacing or transvenous pacing or permanent pacemaker. For a patient with complete heart block, he definitely requires a permanent pacemaker. There is no other go other than this, right? So last time in NORCET 9.0, they have given the ECG of your complete heart block and they were asking what is the management. And the answer was transcutaneous pacing, right? So you should be very clear where you have to answer, like what you have to answer. Like if you're going to know about properly about the types of heart block, then only you're going to able to answer what is the actual management. Initially, if the patient is having a minimal, like in first degree, in second degree type 1, then only we are going to give atropine. If it is going for like primarily we will be managing with the pacemakers only. Position of pacemakers. See, pacemakers, like we have various types of pacemakers, like permanent and temporary. So in temporary pacemaker, we have this transvenous and transcutaneous pacemakers as well, right? So in transvenous pacemaker, we have this electrodes, like monophasic electrodes and biphasic electrodes. Like if you go into a CTVS ICU, you can see the external, like temporary pacemakers, which is set, like the rate, the heart rate, the sensitivity, everything will be set priorly, and based upon that particular instrument will generate the impulses and it will be conducting both atria and ventricles. Like monophasic means either the electrode will be in the atria or it will be in the ventricle, but in case of biphasic, it will be present in the atria and in the ventricle as well, and it will generate the impulses.
Thank you so much, ma'am, explaining these topics very effectively. So we are going to take other question afterwards and we will reply within 24 hours if anybody is having any doubt. So let's move to the next. So here is a special reward for you who have attended this session in the last. So you have to scan this QR code and participate in the quiz and answer all the questions which have been shown in the video, which we have already discussed regarding the plan. And afterwards, you have to install application also to get the special prize as a Masterstroke Volume 3 book, which is a last minute revision book, which will help you to prepare properly and plan your last minute revision effectively for appearing in the exam. And here are the winners of our last UDAAN webinar session who have gained the opportunity to get a Masterstroke Volume 3 book in a prize after attending the quiz and answering all questions correct and installing our NNL1 application. So in the last, I wanted to thank you, all of you who has attended the session, as well as I wanted to thank you all the amazing panel, Ms. Priyadharsgini ma'am, Mr. Shurhabeel, Ms. Priyanka, for delivering such a powerful and student-centric session. And thank you all for joining today, as well as this is a true spirit of UDAAN, students learning, leading, and lifting others. So I'm ending this wonderful evening with all
One
of you.
second.
Keep